Bismillahirrahmanirrahim. This is Ahtara Totahaля, master student of Al-Farabi University Medical Faculty, second year. My topic is physiological role of prostaglandin. I will present this to you. So, okay, what is prostaglandin? Prostaglandin are group of potent hormones like substance that are produced in a various mammalian tissue, are derived from arachidonic acid and mediate a wide range of physiological function such as control of blood pressure, contraction of uterine, smooth muscle, and modulation of inflammation. Why these things or this substance named as prostaglandin, and what was behind this? What was the cause that it named as prostaglandin? So this prostaglandin first discovered in 1930 when Wolfgang Euler found, and he felt that seminal fluid of the animals cause contraction of the uterus. So he had this thing that it may be due to these seminal fluid, and seminal fluid may contain something that causes contraction of uterus. So therefore he named that prostaglandin. It means that prostate gland, prostaglandin means prostate gland, and it means that some things that produced by prostate gland, and that may affect and that may have physiological effect on uterus. So therefore he named this new substance prostaglandin, since they were originally thought to be secreted. In 1945, Bergstrom met physiologist Wolfgang Euler, who was conducting research on prostaglandin. Together, they conducted research on how prostaglandin are formed. During the 1950s, Bergstrom, with the use of Lyman Craig's countercurrent extraction device, he was able to reduce the chemical structure of prostaglandin. He was discovered thus that prostaglandin as formed by the conversion of unsaturated fatty acid. So now we will introduce the prostaglandin to you, that what is prostaglandin and how it performed. So these are class of eicosanoids and were discovered through their effect on smooth muscles produced and released by nearly all mammalian cells, okay, and perform a variety of functions. These are produced in a minute amount and are not stored. It means that urgent it produced in urgent it will be destroyed when its function has been over. It destroys. So let me explain how this prostaglandin produces, what will be the cause, and how it affects. Arachidonic acid is metabolized and produce inflammatory mediators. Many current and anti-inflammatory pain medicine or inhibit some portion of the arachidonic acid pathway. We know that there are two kinds of cell that lining external surface or internal surface of the organs. And that two cells are parenchymal cells and stromal cells. Parenchymal cells are the functional cell of the tissue, and the stromal cells are supporting functional cells. So these two cells are existed side by side with each other. Whenever there are any physical, radiation, biological trauma to the tissue, that trauma make injury to the tissue. So for that injury, response of the vascular connectivity happens. So based on that vascular response, phospholipid with the support of phospholipase A2, that phospholipid A2 convert phospholipid to arachidonic acid, to arachidonic acid. And who will inhibit this process? That was steroid. Normally steroid inhibit the formation of arachidonic acid. I told that phospholipid, with the support and with the help of phospholipid A2, it converted to arachidonic acid, and lysophosphate, PF. And then this arachidonic acid go through two process. One is cyclooxygenase pathway and another is lipoxygenase pathway. This is lipoxygenase pathway. Cyclooxygenase pathway, through this cyclooxygenase, arachidonic acid is converted to prostaglandin, maybe prostaglandin 2, and who will inhibit this process? Non-steroid anti-inflammatory drug. Non-steroid anti-inflammatory drug inhibit all these two processes, and there are two kind of cyclooxygenase, COX-1 and COX-2. Aspirin, diclofenac, ibuprofen, they affect COX-1 and as well as COX-2. So just several medicine like nemsolide, celecoxib, these medicine have no effect on both cyclooxygenase and cyclooxygenase 1 and cyclooxygenase 2, and they just inhibit cyclooxygenase 1. Cyclooxygenase 2 not only involved in the inflammatory process, but it also prevent intestinal mucosa from acid irritation. So therefore, inhibition of cyclooxygenase 1 and 2 causes ulceration in the stomach. So we told that arachidonic acid is converted to prostaglandin. This prostaglandin G then converted to prostaglandin H2, then that will be converted to thromboxane A2, that is vasoconstriction, that has vasoconstriction effect and also platelet aggregation effect. Beside this prostaglandin H2, it also converted to prostaglandin I2, that also called prostacyclin, which cause with inhibition of platelet aggregation and also cause vasodilatation. Prostaglandin H2 also converted to prostaglandin E2, which causes pain, and so on. Prostaglandin 2 and these things, and all of them causes inflammatory pain and swelling. And those prostaglandin which involved in this process, maybe several. So I just want to mention the name of these prostaglandins: prostaglandin F2 alpha, which causes vasoconstriction, platelet aggregation, and conduction of contraction of uterus, which these are also used in the induction of labor, and it causes induction of labor. Another pathway that arachidonic acid, which through 5-lipoxygenase, they converted to leukotriene, and these leukotriene A4, leukotriene C4, leukotriene D4, leukotriene E4, leukotriene F4, leukotriene B4, these causes bronchoconstriction and vasodilatation. They cause in all body have vasodilatation effect except myocardium. So these leukotriene involved in bronchoconstriction, especially in bronchial asthmatic patient. Remember that montelicast causes inhibition of leukotriene, and montelicast have inhibitory effect on lipoxygenase 5-lipoxygenase. And beside this, cytokines that produce tumor necrosing factor, TNF antagonists. These all things are produced by us. Before I told that parenchymal cells cause these things, and stromal cells, which causes secretion of histamine and these things. They also play a role in inflammatory process, and they support the parenchymal cells. So now we come to classification of eicosanoid. They, as I told that, they are divided into categorized into the cyclooxygenase pathway, prostanoid, which is prostaglandin, and lipoxygenase pathway, that is leukotriene and lipoxins. Prostanoid further divided to prostaglandins, prostacyclin, PGI, thromboxane, and they have their own effect, their own physiological effects, which will be explained later. So structurally, the structure of prostaglandin is based on a hypothetical 20-carbon parent saturated acid called prostanoidic acid, and all naturally occurring prostaglandin are 26 fatty acid containing a cyclopentan ring. All prostaglandin have OH group at 15 position and a trans double bond at 13 position. These prostaglandin are classified from A to I, prostaglandin A group in this house further divided into subgroups: prostaglandin B group, prostaglandin C group, prostaglandin D group, prostaglandin E group, prostaglandin F group, prostaglandin G group, prostaglandin H group, and prostaglandin I group. Uh, Mainly, all of them have different several effects on body tissue. Prostaglandin A, this causes platelet aggregation uh, and vasoconstriction. Prostaglandin B, called this is causes vasoconstriction, and this had this prostaglandin C have similar effect. Prostaglandin causes vasodilatation. Prostaglandin E group cause the also it called eugenic group. This causes pain and fever. Prostaglandin F, the causes bronchoconstriction, myometrial contraction. And prostaglandin F group, all of them that I told that all of them are further divided into subgroups, and they have their own effect. Uh, in the subgroup, they may have alpha and X. So X and alpha, they whenever you see with these groups, they causes bronchoconstriction and vasodilatation. Prostaglandin I group, which also called prostacyclin, they have inhibitory effect on platelet aggregation. So now we want to discuss on biosynthesis, how these prostaglandin are synthesized. They aerobically from polyunsaturated fatty acid that I told that phospholipid multi-enzyme complex called prostaglandin H synthase. Prostaglandin H has two components: cyclooxygenase system and peroxidase system. Prostaglandin H system is present in two enzymes, prostaglandin S1 and prostaglandin 2. A cell hydrolyzes phospholipase A2 released from the cell membrane. Lysosome hydrolyzes membrane phospholipid into lipophospholipid and arachidonic acid. Arachidonic acid is converted to prostaglandin by oxidative cyclization with the cyclooxygenase of prostaglandin H and microsome and cell membrane. This system form the first unstable cyclic endoperoxide prostaglandin. Prostaglandin G2 is converted into prostaglandin H2 by the peroxidase enzyme of peroxidase component of prostaglandin H system. Prostaglandin H2 is a precursor of prostanide. This process we discussed before. So this is a schematic show that cells when faced with the trauma injury that we discussed, that was physical, radiation, biological, they face with the phospholipase A2, they form arachidonic acid with phospholipase A2, and they produces arachidonic acid and lysophospholipid, and so on. Arachidonic acid is further with the cycloogenase of prostaglandins. They have further process that we explained earlier. Now we come to physiological effects of these prostaglandin. Um, Prostaglandin involved an inflammatory process that cause swelling, um, pain, redness, uh, hot, and besides loss of function. These are cardinal. We also can say the cardinal symptom of inflammation due to prostaglandin's effect. This thing happens. Prostaglandin are natural mediator of inflammation. Prostaglandin E2 and prostaglandin 1 induce a sign of inflammation, redness, heat, vasodilation, swelling, demand, etc. Pain and fever pyrogen stimulant prostaglandin, especially prostaglandin E2, causes pain and fever, and their effect has obvious hypothalamus region in the brain, one attempt to regulate it. And another effect of prostaglandin is production of reproduction. Prostaglandin E2 and prostaglandin F2 have been used to induce parturition as well as to terminate pregnancy, as we told that these affect normally prostaglandin F2 alpha. These have vasoconstriction, platelet aggregation, and contraction of uterus. They have effect on this, and these cause induction of labor. When it have physiological effect, they cause induction of labor. Orthoptical subcellular synthesis of prostaglandin have been useful in inhibition of gastric secretion in patients with gastric ulcers. Uh, uh, Normal prostaglandin covers stomach internally, and it prevents stomach from destructive effect of acid. Regulation of blood pressure, prostaglandin A and prostaglandin I2 being vasodilators, lower the systemic arterial pressure, increase local blood flow, might help in treating hypertension. Ductus arteriosus, prostaglandin E2 maintain the potency of ductus arteriosus prior to birth. If ductus arteriosus remain open after birth, cyclooxygenase inhibitor like endothacin can be given. Infant with the congenital abnormalities are administered prostaglandin to maintain blood flow. Physiological effect, yes, effects as we mentioned that platelet aggregation, prostaglandin A cause platelet aggregation, while prostaglandin I cause inhibitory effect on platelet aggregation, and these released by endothelial cells is responsible for non-adherence of platelet to healthy blood vessels. Prostaglandin E2 and thromboxane A2 promote clotting process produced by the platelet account for spontaneous aggregation of platelet to thrombin collagen at the site of injury. Uh, Catabolism of prostaglandin rapidly removed from the circulation, as I told earlier, that it rapidly produces and rapidly it cleared. Up to 90% prostaglandin are destroyed in liver. Stimulants, trauma, hypoxia, angiotensin, 2 bradykinin, vasopressin, increase prostaglandin synthesis by activating phospholipase, A2 catecholamines enhance prostaglandin synthesis by activating cyclooxygenase. Addition of GSH stimulates synthesis of prostaglandin E2, which then cause inhibitor false substrates like by 8, 11, 14 ecostatic acid TYA. These have no effect, and mepacrine inhibit phospholipase A. Glucocorticoid, cortisol, beta-methasone inhibit the transcription of prostaglandin 2. Non-steroid anti-inflammatory drugs, aspirin, indomethacin, ibuprofen, diclofenac, etc., cause inhibition of cyclooxygenase, copper and dihydrolipoamide inhibit the prostaglandin formation but increase prostaglandin F. Aspirin, acetylsalicylic acid aspirin is a effective antiplatelet aggregator. It irreversibly acetylates the platelet cyclooxygenase system and inhibits the hampering in formation of cyclooxygenase A2. At same time, it opposes the formation of prostaglandin I2 in the endothelial cell, which was later clinical use, management of angina, myocardial infarction, prevention of stroke, and cerebral ischemic attack. Formation of prostaglandin through arachidonic acid we discussed earlier. And I will say that non-steroidal inflammatory drug aspirin have irreversible effect on prostaglandin. Inhibition of prostaglandin synthesis as a mechanism of action of aspirin-like drugs. The aim of the study was to work out on the mechanism of action of aspirin-like drugs in studies carried out by the Pepper and Wine in 1969. It was discovered that on being a challenge, a synthesized lung of gain-effects releases a substance called RCase, rabbit out a contracting substance along with the histamine, prostaglandin E2 and prostaglandin FA2A. Experiment gain-effects lung synthesis prostaglandins from arachidonic acid. Lung from a gain-effect were excited rapidly and washed with ice-cold buffer. This tissue was homogenized and centrifuged, and the supernatant was used. The homogenate was incubated with arachidonic acid. Dear students, welcome back. I want to discuss on prostaglandin physiological and pathological effects. First of them, platelets aggregation. Activated by membrane phospholipase with the release of arachidonic acid, icosanoid biosynthesis. Major icosanoid formed from tryptoxan A2 and total biosynthesis determined by its urinary excretion. Prostaglandin I2 inhibit platelet aggregation. It disaggregated performed clumps, limited thromboxane A2 activated aggregation. Cardiovascular events following selective COX-2 inhibitor has been attributed to prostaglandin 1 and plus prostaglandin I2 inhibition. Low prostaglandin I2 concentration via EP3 receptors potentiate aggregation. Overall effect of prostaglandin on the platelet depend on activity of which prostaglandin is obvious. For example, prostaglandin A or prostaglandin I. If activity of prostaglandin A exceed, it cause aggregation of platelet. If activity of prostaglandin I dominant, so it cause inhibition of platelet. So when platelet aggregation increases in dominant, it's harmful for heart, especially it causes ischemic heart disease and promote atherosclerotic process. Vascular tone, as I told earlier, that prostaglandin half-life is short, and hence they locally modulate vascular tone. Prostaglandin 2 major metabolites released from vascular endothelium and derived primarily from cyclooxygenase 2, regulated by shear stress, vasoconstrictor or dilatator. Autocords COX-2 derived from prostaglandin 2 via AP4 receptors maintains the ductus arteriosus patent until birth, after which there is increase in metabolism, decrease in its level, leads to closure of ductus arteriosus after birth. Therefore, non-steroidal anti-inflammatory drugs are used to induce closure of patent ductus arteriosus in neonates. For vascular activity of prostaglandin, prostaglandin D2 causes vasodilation, vasodilatory effect. Overall, prostaglandin causes vasodilation, and inflammatory vascular disease studied in meiosis implicate prostaglandin and developmental atherosclerosis, abdominal aortic aneurysm. It has been seen that inhibition of thromboxane A2 retards atherogenesis, deletion of PF receptor, decrease in blood pressures, retardation of atherogenesis, production and perturbation. Prostaglandin 2A, prostaglandin F2A, leukocytosis consists in delayed perturbation in mice deficient in coax and along with thromboxane A2, important in final stage of perturbation. Lung, prostaglandin E2 causes bronchodilator effect on lungs. This prostaglandin also promote pain because this is eugenic. Prostaglandin F2A, thromboxane A2, prostaglandin 2 cause bronchoconstriction, inhaled Luprost, prostaglandin 2 analog, decrease the cardinal feature of asthma in mice via inhibition of airway dendritic function, polymorphism in gene for prostaglandin 2 synthesis and the TP receptor associated with asthma, DP12 associated with the allergic responses. Beside this, you can say that leukotriene also has effect on lung that we discussed, that leukotriene partially oxygenase pathway from arachidonic acid, which has bronchoconstriction activity, and its role is obvious in the patient with suffering from bronchial asthma. On kidney, long-term use of all cyclooxygenase inhibitor is limited by the development of hypertension, edema, and congestive heart failure. Prostaglandin E2, prostaglandin I2 play a critical role in maintaining renal blood flow and salt excretion. Their synthesis is increased in response to factor which decrease renal blood flow. Inflammation in immune response, host of stimuli which elicit inflammation in immune response lead to increased prostaglandin synthesis. Prostaglandins play a significant role in this response. Prostaglandins promote acute inflammation. Exception, prostaglandin E2 inhibit mast cell activation, thereby inhibiting inflammation. All cardinal symptoms of inflammation, which are 5, such as pain, redness, and heart, loss of function, and swelling. All these things are due to activity of prostaglandin in various, as we discussed in our past slides. Physiological activity of those varieties of prostaglandin have effect on inflammatory process. Heart, prostaglandin 2, prostaglandin E2 via AP-EP3 receptors protect against oxidative injury in a cardiac tissue. IP deletion augments myocardial ischemia, reperfusion injury, and prostaglandin ES1 and EP4 deletion increase in decline of cardiac function. Thromboxane A2 contribute to oxidative stress. Pharmacological inhibition or deletion of cyclooxygenase 2 restrain tumor formation in models of colon, breast, and lung. Use of non-steroidal anti-inflammatory drug is associated with decreased risk for development of these cancers. Prostaglandin A2 primary oncogenic prostanoid, also thromboxane A2. Familial polyposis patients show decrease in epilepsy on treatment with the cyclooxygenase inhibitors. Pharmacological effects, cardiovascular system. Prostanoids do not circulate, hence do not directly impact systemic vascular tone. It does not have direct effect, but some process will pass. And beside this, pharmacological effect of prostaglandin is not for long time. It passes rapidly. The modulate local vascular tone as a site of formation, affect systemic blood pressure through renal action, including change to different arterioles. Prostaglandin E2, prostaglandin I2, prostaglandin D2 elicit vasodilation and drop in BP. So overall, we can say that on cardiovascular system, Uh, their effect may be due to blood pressure uh, and um, vascular tone, and platelet aggregation has an effect on cardiovascular system, especially in atherosclerotic process. Prostaglandin E2 was construction through AP1 and 3. Prostaglandin 2 flushing, nasal stiffness, hypertension, local subcutaneous release contribute to vasodilation of skin. Prostaglandin 2 release vascular smooth muscle causing hypertension and reflex tachycardia in IV administration. Thromboxane A2 potent vasoconstrictor and contract smooth muscles. Cardiac output increase on prostaglandin E if infusion. Platelet low concentration prostaglandin E2 via AP3 increases platelet aggregation. High concentration prostaglandin E2 via IPGS EP2.4 decreases platelet aggregation. Prostaglandin I2, prostaglandin 2 inhibit platelet aggregation. Mature platelet express only COX-1. Megakaryocytes immature platelet turnover express COX-2. Thromboxane, a two major product of cyclooxygenase 1 and platelet. It induces platelet shape change and aggregation. By changing a platelet shape, it precipitated to aggregation, and while platelet aggregated, these activity of the platelet will be permanent. It implies signal for other more potent platelet agonists, e.g. thrombin. Its action are restrained by the short half-life, 30 seconds, by rapid TP desensitization, by endogenous inhibition of platelet function by nitric oxide, inflammatory in immunity. COX-2 major source of prostaglandin formed during and after inflammatory responses. Prostaglandin E2, prostaglandin I2 predominate as a result of increased vascular permeability and blood flow in the inflamed region. Thromboxane A2 increases platelet leukocytes interaction. Prostaglandin D2 contribute to resolution of inflammation. Prostaglandins generally inhibit lymphocytic function and proliferation, suppress immune responses. Prostaglandin E2 depresses humoral antibody response by inhibiting the differentiation of B lymphocytes into antibody secreting plasma cells. It acts on T lymphocyte to inhibit their proliferation. Prostaglandin 2 major product of mast cell. It is a potent chemoattractant primarily through DP1. Activation of DP1 promote chemotaxis, activation of T helper lymphocytes, eosinophils and basophils. Smooth muscles. Prostaglandin contract or relax smooth muscle outside of the vasculature for bronchial and tracheal muscles. Thromboxane A2, prostaglandin F2A, prostaglandin D2 contract, prostaglandin E2, prostaglandin I2 relax, prostaglandin D2 primary bronchoconstrictor. Uterus, thromboxane A2, prostaglandin F2A contracts uterus, and it causes induction of labor. Prostaglandin E relax. This opposite activity of thromboxane A. Sensitivity to contractile response in most prominent before menstruation. Relaxation is greatest in mid-cycle. Low concentration of prostaglandin E2 in prostaglandin F2A contracts uterus. Low concentration of prostaglandin E2 in oxytocin, essential for onset of parturition. High concentration of prostaglandin E2 in prostaglandin 2 causes relaxation. Prostaglandin E is in prostaglandin F used for medical termination of pregnancy. GIT muscle. Prostaglandin ES, prostaglandin FS stimulate contraction of main longitudinal muscle from stomach to colon and stimulate movement of water and electrolyte into intestinal lumen. PFI2 thromboxane A2 also produce contraction, less active. Prostaglandin E2 relaxes circular muscle. Prostaglandin F2A contracts circular muscle. Diarrhea, cramp, reflux of bile, common side effects in patient given prostaglandin for abortion. Gastric intestinal secretion, stomach prostaglandin E2, prostaglandin 2 increases mucus secretion, decrease acid secretion, and decrease pepsin content. These result of the vasodilatory property and direct effect on secretory cells. Prostaglandin E2 and analog also inhibit gastric damage caused a variety of ulcerogenic agents. Also promote duodenal and gastric ulcer healing. Kidney renal prostanoids perform complex, intricate functions. Both medulla, cortex synthesized prostanoid, COX2 derived prostaglandin E2, prostaglandin I2 increases renal blood flow and glomerular filtration through their vasodilatory effects also increases medullary blood flow and inhibit tubular sodium reabsorption. COX1 derived prostaglandins promote salt excretion in collecting ducts. Thromboxane 2 potent vasoconstrictor. Prostaglandin F2A natriuresis and diuresis. I. Prostaglandin F2A overall effect is decreased by AOP by increasing aqueous humor outflow via scleral and trabecular pathway. Variety of PF receptor agonists have proven effective in open-angle glaucoma. Its condition associated with loss of COX2 expression in pigmented epithelium of ciliary body. CNS prostaglandin E2, induction of fever, prostaglandin D2, induction of sleep. Hypothalamus regulates body temperature set point, which is elevated by the endogenous pyrogens like interleukin IB, IL-6, TNFA, and interferons. Thermoregulatory response is mediated by the induction of cyclooxygenase 2 and MPGS1 is endothelium of preoptic hypothalamic area to form prostaglandin E2. Prostaglandin E2 crosses blood-brain barrier and acts on on thermosensory neurons, triggering hypothalamus to increase body temperature by increasing heat generation and decreasing heat loss. Pain. Prostaglandin increases sensitivity of nociceptor and potentiate pain perceptions. Prostaglandin E2 via EP14 and prostaglandin 1, 2 via IP induces threshold to stimulate of nociceptor causing peripheral sensitization. Both coax are expressed in spinal cord, releasing prostaglandins upon peripheral pain stimulation. Endocrine. Prostaglandin E2 increase ACTH, GH prolactin, gonadotropin level, and it increases steroid production, stimulate insulin release, helps in induction of oocyte maturation. Prostaglandin F2A induces oxytocin-dependent decline in progesterone level and parturition. Bone. Prostaglandin are strong modulators of bone metabolism. COX-1 is dominant in normal bone. COX-2 is dominant in inflammation and mechanical stress. Prostaglandin A2 stimulate bone formation by increasing osteoblastosis, also mediate resorption via osteoclast activation. Indication. So here we want to discuss on synthetic prostaglandin that we give to the patients. There are different indication for each drug. Some are listed below. Alloprostadil, there is penile injection 5, 10, 20, 40 mcg steroid fodder for reconstitution. Beamerprost, Lamegan, ophthalmic drop that we discussed earlier, 0.03% solution. Epoprostinol, prostacyclin intravenous 0.5, 1.5 milligram powder to reconstitute. Iloprost, Ventavis, inhalation 10 mcg or milliliter solution. Misoprostol, the generic oral 100 and 200 mcg tablets that are available, and dinoprostone, prostaglandin E2 vaginal 20 milligrams suppositories, 0.5 milligram gel, dinoprost intraamniotic injection, latanoprostol, that used topical. Adverse effect. These are adverse effects that we discussed earlier on GI system, that were their effect on GI system and their effect on female reproductive system. We discussed earlier, and longitudinal muscle contracted by prostaglandin A2, circular muscles constructed strongly by prostaglandin F2 alpha and weakly by prostaglandin I2. And on female reproductive system, thromboxane A2, lower concentration of prostaglandin A2 contracts the uterine muscle, disturbed menses, and also seen in some time. Male reproductive system prostaglandin causes pain as if taken in excess, effect on cardiovascular system. In most vascular beds, prostaglandin A2, prostaglandin F1, Fi2 are and prostaglandin 2 elicit vasodilation and drop in blood pressure. Prostaglandin 2 can cause vasoconstriction through activation of EP1 and EP3 receptors. Leukotriene and leukotriene D4 results in hypotension. Some side effects that are due to synthetic prostaglandin are flushing, nausea, diarrhea, hypertension, headache, and nasal stiffness. Mainly, leukotriene also causes nasal stiffness. Conclusion, we can say that leukotriene and prostaglandin are the generation of prostaglandin by the cell-free enzymes preparation and weight was measured by the bioassay. Aspirin-like drug inhibit the formation of prostaglandin. This enzyme inhibition was proposed as the mechanism of a therapeutic action and side effect of aspirin-like drug implicating prostaglandin in inflammation. Prostaglandin is formed from phospholipid and with enzyme phospholipid A2 to arachidonic acid passes through pathways, oxygenase pathway and lipoxygenase pathway. Cyclooxygenase pathway produces prostaglandin, and we discussed with the full detail how prostaglandin is created, and lipoxygenase 5-lipoxygenase pathway causes production of leukotriene, which causes bronchoconstriction. Thank you from your attention, and I take those references in this presentation. Hopefully you take you listened, and thanks from your patience. If you have any question, you can write me through Ahtar Totahal at yahoo.com or Ahtar Totahal2 at gmail.com. Thank you so much.